I would like to welcome a very special guest to our podcast today, focusing on women in vascular surgery. Dr. Kathleen Ozsvath is the Chief of Surgery at Samaritan Hospital in Troy, New York, and the Director of the Vascular Service. She's the President-elect for the Eastern Vascular Society and serves as the Intersocietal Accreditation Committee Vein Center Secretary. She has been a leader not only in her community, but in research and has multiple publications. And she's a pioneer in DEI issues and has been awarded Women of Distinction by multiple groups. She's a trailblazer on multiple fronts. Welcome.
Thank you so much, Anil. I really am honored to be asked to be part of the podcast, and I look forward to chatting with you.
What have been some of the challenges you've had as a woman in vascular surgery?
That's a great question. If you don't mind, I'll take it sort of back to medical school. I was told by surgeons when I asked for letters of recommendation, I was told I can't be a surgeon because I'm a woman and I would do better in a field where I can take care of a family. And so I smiled and I flew due north and ended up in New York City where I did my residency training together with you. And I have to say, it was a breath of fresh air. Working in New York was great. We didn't have those, or I didn't feel those kinds of issues at all. In residency, we had Dr. Donna Mendez and Dr. Maria Aronis, both amazing female surgeons and quite the forces in their fields. And they were huge mentors to me. I then did my vascular surgery training in Albany, New York, where again, I had really amazing mentors who really did support me. And I really never felt in any way, shape, or form that I wasn't given equal footing. Certainly during my training, sometimes, starting off, there were times where I felt like maybe had I spoken up more or like at a business meeting or something along those lines, I think there were times where I was quiet, which is hard to believe now, huh? But where I didn't stand my ground the way I've learned to do since then. But from a standpoint of being a woman, I do feel like I had incredible opportunity. When I started working at Samaritan Hospital at that time, the CMO approached me and asked me to become chief of surgery. And I felt that to be a huge honor. And he did a lot of mentoring and really taught me a lot. And I think that I just evolved. I don't know really how else to put it. And, I just forged forward and did my best and found great mentors such as you. And there were great mentors during the course of my career, Vivian Gatton, Linda Harris, just to name a couple who really supported me. And I felt that looked out for me from a career standpoint.
So, were there some specific challenges that you had in the venous field?
So that's an interesting question. So when I was training, the whole vein thing was looked down upon, which happens a lot. I had a huge struggle because I felt in a way, because of my interest in veins, I was kind of pigeonholed into it. And I felt like I had to personally fight to make sure that I continued to see arterial patients because I was worried that if I stop seeing arterial patients, I won't be able to take call. And that was very worrisome to me. So in a way, I felt that I had to kind of fight for that. I don't know if that makes any sense, but yeah, I really worked hard at trying to keep the veins and the arteries sort of balanced, if you will. I did a lot of work in veins, especially early on. We opened our first outpatient vein center, and I worked really hard. I think that again, it would have been extremely easy to get pigeonholed into only doing that, and I wasn't ready to give up arteries at that time. We've come a long way since then. I'm, in a different group now, and we have our own vein center, but it's much more equally shared amongst us. Um, I have three male partners. They're all really wonderful guys, and all three of them, two of them do superficial veins, and the third one does mostly deep veins. And I guess everybody does the deep veins. The only thing that I do that the guys don't like so much, I think, is the pelvic venous disease. That tends to come into my office more often. But I don't know if it's just a natural thing, or if the patients are seeking me out, or what it is exactly.
Some of those challenges that you had along the way, how did you overcome some of those challenges with being a woman in vascular surgery?
So there were a couple of things I noticed. One was when I went to the Society for Vascular Surgery meetings, obviously the number of women were much lower, especially early on, than the number of men. And I felt that that's a big society, and it would be hard for me to make any kind of a footprint there. So I also had a huge interest in venous disease. So I turned my attention to the American Venous Forum, where I have to tell you, I have always felt included and supported. And so I spent a lot of time there. Then there was the Eastern Vascular, that was my regional society that I joined early on. My mentors told me that that would be a good idea to join and to work, and I felt like there too, I felt included, and there were some great female role models, but there were also some really great men that were very supportive. So I think that what happened ultimately there, I kept my nose to the ground and I just worked hard. And it may have taken me longer to get to kind of where I am today in the society. Maybe because I'm a woman. I don't know, but ultimately the hard work prevailed, and I'm blessed and honored to be in the position I'm in. And I think it's thanks to people like yourself and Vivian and Linda, and who supported me along the way.
I want to ask you a little bit about the role models. You mentioned a few of them. Um, you mentioned Dr. Donna Mendez, you mentioned some other people. How do they help you along the process?
Oh my. Well, you have worked with Donna. She's a force to be reckoned with. And I was so impressed even as an intern, with how well spoken she was, how intelligent she was, how good she was technically, and I wanted to grow up to be just like that. And so that certainly, initially I was interested in cardiac surgery, but then I realized that cardiac surgery was changing, and that really would be difficult in some ways. And I thought, you know what, I'm going to be like Donna. So I'm going to go. I love vascular. I love I love doing the bypasses and the carotids and the whatnot. So I chose that, and I am really grateful that I did that. And I think a lot of us who trained at St. Luke's and Roosevelt owe a lot to Donna, because she was an incredible role model. She cared about the residents, and she was super supportive. Yeah, I mean, along the way, other role models that, I mean, first of all, I can't sit here and speak to you without thanking you from the bottom of my heart. You were my third year resident, and you were always a rock from a long time ago till this day. So you've always been there, somebody I can reach out to, somebody I can talk to, run cases by, etc. So Vivian and Linda, I met in the EVS initially, and I was totally in awe by the work that they did, and I wanted to be like that. I wanted to have that kind of impact, like what they had on me, on others. And yeah, Ruth Bush, I can't leave her out. I mean, she's she came along a little bit later, but in my AVF path, and she's given me incredible opportunities. I went and visited Julianne Stoughton's vein practice back in the day in 2000 or 2001. So again, there were these like important sort of female role models, Julie Freischlag. I mean, in my life, who really led the way for many women, not just me. Yeah.
So what words of wisdom would you like to impart to young women early in their career in vascular surgery?
I think one of the things that's really come out of, sort of over time is that women are good at empowering one another to speak up, to be heard, to care about women's issues, such as, there's a huge push now in research to have more female patients involved, to have more women involved in research as PIs, whatever that it may be. And I think that that's a very positive thing. I think there's also much more kindness, if you will, towards women today than there was when I first started. When I first started, I thought I couldn't have a family because, if I wanted to be serious or taken seriously, then I would have to just sort of do nothing but vascular surgery. And I have to thank, Dr. Shaw a lot, because I remember one day he set me down and he said, "Come on, like, you need to also have a family." And I remember going home and saying to my now ex-husband, but this is what Dr. Shaw said. And, it again, I had my daughter. I was in a group that was very, very positive when it came to family. And I think that today we're much more understanding of one another, not just women, but men also. And I think that men need to be a part of their children growing up. And I think that today's younger men do that and do it well. And I think that we all as a society, as a vascular society, but also as just humans, we need to be kind to one another, understand that when we go home at night, we need to be with our families because they need us. I don't know.
Great words of wisdom, and thank you so much. You've been really a shining light for many, many women and trainees and young vascular surgeons. So thank you so much. Thank you very much for this podcast. We're really looking forward to distributing it.
Thank you, Anil.